Hello, happy Friday. My name is Julie Hirschberg. I am the owner of Reactive Physical Therapy and Wellness, which is here in the Los Angeles area. And at Reactive, our mission is to help people improve their strength, their movement, their confidence, get back to life through brain changing therapy and exercise. And we do this through our therapy, PT and OT, personal training, group exercise, and through a lot of education of other physical therapists. And I smile at brain changing because I get really excited when we start taking a path, talking about different techniques and treatments that are truly brain changing, and they have research to support that. And that's one of them that we're going to talk about today. Our topic is grounding, and it's very appropriate. Grounding, staying grounded during turbulent times. These are certainly turbulent times for sure. We're in the midst of a pandemic, which is still going very strong here in Los Angeles. We're in the midst of having a lot of emotions, stress, a lot of discussions with friends and family about issues surrounding race. They can be, all of this at once can be really overwhelming and overwhelming to the nervous system for sure. I know that I'm seeing that in the people that I work with. I am seeing it in myself and my colleagues. I'm sure you're seeing it too, right? And I have found myself turning towards these types of techniques for myself, for the people I work with more and more during this time. So today I want to share one simple method. I got another printout here, a free download for you that has been very helpful this week. I've actually sent this to people several times this week, practiced with them when stress rockets, having a grounding practice. So today, there's so much I can talk about, but we're going to talk about what are grounding practices, why you might use them, and a little bit of evidence too. An example. So we'll talk through this example and this resource that you can download for yourself, for the people that you work with. Send it to your family. I think it's a really great practice. So I wanted to tie this into some of the things that we're doing with reactive. So a couple pieces of background here. Last night we had this great brain bites discussion within our community, and we talked through a couple of very complex cases where differential diagnosis and referral and even like what is this questions were happening. And one of the biggest questions, well, where do I start then when they need a referral, when I don't know what's happening, but their nervous system is clearly in overdrive, whether that's sleep deprivation, whether it's functional symptoms. Where would you start? Grounding. So we talked about this. Um, and I have a couple of disclaimers going into this talk too, because this is something that has been really like personal to me and to when I've seen other people work through these practices too. When thinking about using some of the mindfulness practices for yourself or with a patient, if you are in the midst of a really profound nervous system dysregulation, high stress state, high fight or flight, and it's hard to come down from there. So that might be like think about like after a car accident, right? Or with trauma. This is where some of these practices really require you working with a therapist. And in particular, thinking about if this stress is coming out in your body, a body-based therapist. And some of this world is actually new to me. I've talked to my own psychologists about these areas, there are specific areas of psychology focused on this. So somatic experiencing, sensory motor psychotherapy, and actually this grounding practice is rooted in both a psychology background and a mindfulness background. I know there's a lot of overlap there, but I wanted to give a disclaimer that this doesn't work for everyone. Some people really need the one-on-one support, because actually the techniques, if you're in a highly dysregulated state, they can actually make things worse. So it's not just like you can just give everybody mindfulness and they're better. That's not it at all. And some things really require one-on-one support. So there's my disclaimer. Okay, so I want to give you a little background on myself too, to give this context. Grounding practices are a big part of yoga, and that's definitely where I had my intro to grounding. I've been practicing yoga for over 15 years. I've experienced very deep healing and nervous and immune system regulation through those practices. I have also had the great fortune to work with amazing OTs and yoga therapists who have extensive training in this practice. And I have participated in mindfulness-based stress reduction course a few years ago. I did one of the 8-week intensive courses, and grounding is a part of that course as well. So I am by no means a mindfulness instructor or a yoga therapist or a yoga instructor or a psychotherapist, but I don't think you need to be. I will say it is very helpful for you to have this practice for yourself, to teach it to others, though. So I'm going to recommend this as you start wanting to share this with patients and practicing it yourself. So I've been using some of these techniques for a while in practice, and so have our amazing team at Re+active. And I probably started using it most working with dizziness. And it's a very common practice in working with 3PD, for example. But I've really incorporated it all over, which I think you can too. So that's the background. Let's talk now about what are the grounding practices. So grounding techniques are a type of mindfulness that works to develop interoception. And interoception is defined as the process through which the brain monitors and updates the body about its overall physical state, including the ability to recognize bodily sensations, be aware of emotional states, and maintain physiologic homeostasis. And so in that, it's a subset of mindfulness. And I even like these have just been hanging out around me a lot these days. Mindfulness, defined by John Kabat-Zinn himself, is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of the experience moment by moment. So we take those definitions and kind of narrow down to a physical grounding practice. So this is a moment by moment awareness and attention to a physical presence. And you'll see that as we talk through the steps here. So why would you even do this, right? Why is this helpful? So for a lot of the people that we work with, and especially right now, this is a very powerful way to calm the nervous system, to regulate the autonomic nervous system. And a lot of the work and background in here is in the mindfulness research, of which there's a ton. And specifically, these physical grounding techniques are a part of what Elizabeth Stanley's work has been with the mindfulness-based fitness training. And she has this book, which is on my list. I have many books that I'm trying to read right now, but it's called Widen the Window. And she describes this this mindfulness-based fitness training as a way to widen a person's window of tolerance for stress arousal, and do it in a trauma dysregulation sensitive manner. Doesn't that sound wonderful? That is definitely what I need and what the people I work with need. So the key is to actually improve the functioning before going into a stressful event. So her research has been in the military, so this makes a lot of sense. Build this grounding muscle, so to speak, so that you can have better autonomic nervous system tone during the experience and more effective recovery afterwards, which I think is so important. Stress is inevitable. So how does our autonomic nervous system react in the moment, and how does it recover after? So, in the mindfulness-based fitness training specifically is more than just grounding techniques. Absolutely, that's just one piece, but that piece is a very important piece, and that's what will what I refer to with the grounding technique is that physical grounding piece that they have in the mindfulness-based fitness training. And the big focus of why we do this is to improve that attentional control and then tolerance for challenging experience. So a lot of the pieces of the graded exposure that we do have its basis in grounding. So the mindfulness based fitness training, it's an 8-week program like the MBSR training. It's 20 hours long. So we're not talking about, I'm talking about a technique of a larger program. And I just want to, for all that brain, for everybody else who's interested in the brain changing aspect of this, I want to just talk very briefly about one piece of Dr. Stanley's work. And this was from Haas and colleagues in 2016 in Social Cognitive and Affective Neuroscience. It's free full text, so I'll put the link in here. They looked at two groups of Marines. One was a control group. One did the 8-week, 20-hour program, and they did functional MRI imaging to look at specific areas in the brain. And what they found that the Marines who underwent the training had significant attenuation in the right anterior insula during the experience of stress, and they did a loading breathing activity. And so what they found, because of these areas of the brain specifically, that this training changed brain activation, so that people were able to process aversive stimulus better. So yes, it changes the brain, which is what we're all about. So, how can we do it? What are the techniques? How do we set up to do it? So, our OT, who's amazing, by the way, Naoya Ogura, he, when we've talked about this before with our staff and training others, he sets this up really nicely. Is you really need to connect with the person that you're doing it with to get a feel for the cultural fit of it. What is their understanding of mindfulness and these physical grounding techniques? Maybe even starting with some education first, and then finding your own voice. I know I have particular mindfulness instructors I love listening to, and a lot of it is their voice and how they say things. And you need to find your own voice. I cannot mimic John Kabat-Zinn whatsoever, so I have the Julie Hirschberg voice when I do these things. Um, so that's one piece in kind of setting this up for yourself, and then moving into a practice. So we have this as a free download for you, and I just want to briefly step through the steps of how you might use this, but it's written for you here. So this is a simple sitting grounding technique. It's based on the work by Elizabeth Stanley in her mindfulness-based fitness training. I think it's called contact point practice is what they call it within that training. So this is a modification that we've been using in our practice with people with neurologic disorders. So you start in sitting, typically in a chair, back up against the chair, feet on the floor, so that you have several points of contact. You have your back, you have your thighs, you have your feet, and then your hands on your lap. And the first step is just to notice. to bring awareness and attention to those points of contact with the surface. And I typically have people just notice the floor supporting the feet, notice the thighs supporting the hand, the chair supporting the thighs and the hip, the back supported by the chair. Just notice those pieces. And sometimes it takes a little wiggling around. That's how I tend to notice things and pay attention. So those are the first couple of steps. The third thing is a choice. And I love this because it's autonomy. So you choose the strongest contact and hold the attention there. So that could be through the feet, it could be through the hands, it could be through the hips, but you pick one of those, and that is going to become the attentional focus and the mindfulness training piece right there. So as you're sitting there, and right now I usually have to close my eyes for it. It's not required. It's another choice that I give people is you need to close your eyes here. I usually have to close my eyes. Oftentimes it's my hips where I really feel a great support and lift and pressure from the chair. So I'll notice that. And then my job in this practice is just to keep bringing my attention and awareness back to that point. And that then includes non-judgmentally, which was very hard for me in mindfulness practice, to just keep bringing that attention back. The mind is going to wander for sure and start figuring out your shopping list for the day, and then just gently tug it back to that attention point. I will often start with a very short amount of time, 1 minute, 2 minutes, and then we structure this to gradually build. And we talk about building this muscle of grounding, of physical grounding, where I have seen it very, very helpful. So, step four is notice any changes. So, sometimes if I'm working with a person with a functional movement disorder, the tremor is gone, the dystonia is gone with this type of technique. Or we build up the capacity here, and then they have the ability to control some of those things in stressful situations. So, oftentimes in a functional movement disorder, as stress goes up, symptoms go up. And this is a way to bring in the parasympathetic nervous system to lower that and increase the threshold so that those symptoms are less likely to be triggered. So that's one example. I'll also use this with 3PD. So what the person might notice as they open their eyes again is that dizziness is less. And so we'll use the grounding in between exposure to things that might be visually stimulating, for example. So we just keep coming back. And this is a tool then that that person has where they have control and autonomy, and can do something in the midst of changes in the nervous system. It's very powerful. So I'm going to recommend try it this weekend. Try it this week. Practice. How long can you build up for? And try it with a person that you're working with where their nervous system may be dysregulated, where they may have a high fight or flight. And also be okay with it not working right away, but knowing that you're building something so that it can become very useful in a stressful situation. So there you have it. We talked about the what are grounding techniques, why we do them with a little bit of evidence. I have more for you too. So I'm going to drop in some links because there's a lot of free text. We talked about the how and a very simple way that you can do it yourself. So you can download this, reactiveeducation.com/grounding. I'll put a link in for you as well. and I hope that you find it helpful. Let me know how you're using it and how you found it helpful as well. And Doro said grounding is great. We use it a lot for people with dystonia. We do too. In fact, dystonia, functional disorders, 3PD, we have always used it. And I find now, just with what's happening in the world, I'm using it everywhere. And I'm really kind of excited to try it with my kids. They're not super excited about mom bringing work stuff to them, but we're going to try it anyway. I think it's a really handy tool. I wish I had it when I was a kid and had to like speak in front of the class, for example. So, thanks again so much for joining me today. I appreciate your support and community more than you even know. It has really sustained me during these times, and I look forward to catching you next week.